He didn't film the hospitals where my uncle died with kidney failure and not having dialysis equipment to do it 3 times a week.
On the doctors, it's very interesting because I remember documentaries. I think it was Michael Moore or something who was doing documentaries on the Cuban medical and then all this humanitarian and how great they are and stuff like that. And I'm like, you are just a fat commie. Like these two things, like you are
He's
morbidly
such a
obese.
liar.
Yeah. And I'm like, what do you know about communism? Like, lose 200 pounds, stop eating because there's no food, or eat your pet, or
Yes.
bark off of a tree because that's really communism. And like, who are you to comment on any of these things? And then, pat them on the back for all the humanitarian aid. And like you said, I think a lot of them were going out there and spreading bad ideas.
Yeah, they are the poster child, Mikhail, of the useful idiots. I mean, they have been fed this propaganda. We're talking about KGB Stasi handbook type of techniques, the same way that they have captured the American mainstream media since 1959. And the irony is that I remember I was still in Cuba when Michael Moore went to do that. And you know which one were the clinics and there were only like 3 that he used and filmed in the documentary. Number one was the Amejera Hospital that back then was not in the ruins that is right now, which is the hospital where only the foreigners that go and pay with dollars can go. And the other 2 clinics is 2 clinics on the west side of Havana, where only the diplomats and the high elites of the military, the party, and like the elites of the ministries and all that, the people that are really well connected in that high elite of the animal farm of Cuba, those are the only people that have access to those clinics. He didn't film the hospitals where my uncle died with kidney failure and not having dialysis equipment to do it 3 times a week. He didn't film the hospital where my dad almost died on a botch surgery that had to be fixed years later when my siblings took him to Germany. He didn't film, the little doctor's clinic in my working class neighborhood of Havana. So yeah, he is a liar. And he is the type of people that by promoting and propping that lie, he is as guilty as whoever is the leader of the Communist Party in any given country today.
I have a friend of mine who was in a motorcycle accident in Venezuela, I would say maybe a year, maybe 2 years ago. And he was showing me pictures. They didn't even have bandages or blankets at the hospital. And his family had to go out to buy all the bandages and all the equipment so that they could perform the surgery on him for his leg, because they really messed up his leg. And so they had to bring their own blankets, bedding, bandage, like all of these types of things in the hospital, and they couldn't begin and do anything until that happened. Like, that's mental. Like, that is absolutely...
That's the wonder of the socialist, free, socialized healthcare. There's always levels of society, and only those that are on the high elites are the ones that have the decent care, and the rest of the population, they are literally dying in hospitals right now as we're sitting here, dying in hospitals in Havana. There is no running water in the entire country, so hospitals are part of that. You have to, like you said, you have to bring everything. You have to bring medications. We're talking about back in 1994 when I was still in Cuba and my uncle was going through these treatments for a very brief period of time before he passed away. There is a medication that they needed to include in his IVs to treat his kidney disease that my brother from Germany had to send once a month because you couldn't find it in the hospital for an average Cuban in Havana, nowhere to be found. And it's the same today. You see patients that have access to anything dying of neglect and malpractice. And then you have this black market operation where people that can have access to money from remittances or something to barter or trade, then they get the better healthcare because they have something to offer to the doctors or the nurses. Because the reality is that those doctors and those nurses are starving and dying exactly like the same of the rest of the Cuban population.
Well, and we see the same type of thing with the load sharing. I was looking at the sometimes we do Zoom calls and stuff like that. Sometimes you can get on, sometimes they can't get on. There's load sharing. The electricity is not reliable. I mean, once again, it's like Zimbabwe or something. Like, it's unbelievable.
The situation today have reached the point, because I was talking to this friend of mine not that long ago, that Cubans that have found a way to trace family lines to Haiti, they are moving to Haiti.
Oh,
I
Jesus
mean, if
Christ.
that doesn't tell you everything you need to know about the level of society disintegration and absolute collapse of a country, I don't know. I don't know what could be a more clear message, honestly.